Hi, this is Jessica DeMassa in the Guidewell Insights Lounge here at Singularity University's Exponential Medicine. I'm joined by Josh Lee. Josh is a principal with Deloitte. So welcome, Josh. Thanks for joining us today.
Thank you, Jessica.
Thanks. So tell us a little bit about what you consult on specifically at Deloitte.
So I lead our team at Deloitte that helps CEOs and boards of hospital systems sort out all this change and all these uncertainties and lay out plans for how they want to evolve over time. So we do strategy projects that help them sort out innovation, the kind of key questions that a medical system needs to answer in this complex day and age.
So we're here at Exponential Medicine, and there's obviously a lot of talk about technology.
Yeah.
And I know our experience integrating technology into care delivery, EMR is notorious for how that went.
Right.
So what are some of the things that you're looking out for, that you're advising on in terms of helping healthcare systems integrate technology in more effectively?
Yeah, it's such an interesting question. This is my third time at Exponential Medicine. And I remember when Deloitte started getting involved with this, we were so excited with all the incredible potential of all these new devices, new processes, new scientific breakthroughs. And what's amazing is how hard it is for the typical American system to integrate this in to their daily practices, whether that's talking about physician clinical models, the economic model of the hospital, or even their technology strategy. So that's really been the fascinating thing for me, seeing this 3 years in a row, is how difficult it is for the average system to make sense of this, to prioritize and then take action.
What do you think some of the problems are? Like, what are some of the things that are making it so challenging to integrate technologies like these in?
Yeah, there's a couple of things. One is the finances.
Okay.
One thing that was amazing, a lot of people don't know, is that recently telemedicine visits were not actually compensated in the typical reimbursement. So you didn't get paid if you did a telemedicine visit as a physician. That's starting to change now. So some of the incentives in our healthcare system are starting to promote more aggressive adoption of the new technologies. But so one was financial.
Okay.
The second was really the culture of medicine. So physicians are often very particular about the way they practice medicine, and many of the things we're learning about here at Exponential Medicine challenge and even threaten some of those old models. So when it comes down to the individual physician, a lot of times they just don't want to take a chance with some of these new technologies. A really interesting question is the role of patients.
Okay.
Some of our research shows that patients are very eager to see the kind of cutting edge technologies that they're experiencing elsewhere in their lives applied and integrated into their healthcare experience. Other studies show that patients are a little wary of it and kind of like some of the old traditional models. There's a very interesting kind of age breakdown. So we just did a bunch of customer research on millennials and how they experience healthcare and how it's different from older patients. And millennials are often saying things like, why are you coming to me with a piece of paper? I want to see a digital image of what's going on with me. I want to be able to click and get background on my condition. And they're starting to treat healthcare the way they view the rest of their lives and want technology to be part of the experience. So there are real differences depending on what kinds of patients you're talking about.
Okay, so tell me, from your perspective, I guess, which of the exponential types of technologies are you most excited about seeing integrated in? I mean, we hear a lot about big data. We're talking about blockchain and the promise there for both data exchange as well as financing, genomics. I mean, all of the deep learning AI. So let me know.
Yeah, it's so amazing the kinds of technologies that we're seeing there. And I guess I sort of had two reactions over the course of this conference. I love the potential of big data and the analytic powers that we might start to bring. Peter Diamandis is talking right now about human longevity and being able to understand disease processes way before the typical person would even be aware that something's going on with them. So that's so exciting and could potentially be so transformative for medicine. Some of the things that I saw were actually that were really powerful, I think, were some of the lower tech innovations that we saw.
Like what?
So for example, Dr. Hyman's talk on functional medicine,
Right.
in some ways that really wasn't about, I mean, he's taking advantage of many of the new technologies, but that wasn't really a technological breakthrough. It was a change in mindset and a change in philosophy about how medicine should be practiced. It's very powerful. Or I love the examples of the use of 3D printers in disaster relief.
Right.
To do a relatively low-tech thing, replace a bolt on a fetus incubator that really couldn't be done because of problems with the supply chain and getting simple parts to the communities that need them most. So even it's a fascinating example of a high-tech solution, 3D printing, used to solve a very low-tech problem.
Right.
So.
Well, thank you so much for joining us. We really appreciate your perspective, especially coming from somebody who consults with some of these big healthcare systems. It's good to make sense of all of these different changes that are coming down the pike.
Good.
So thank you so much, Josh, for joining us. I'm Jessica DeMassa in the Guidewell Insights Lounge at Singularity University's Exponential Medicine.